Hello, my name is Dr. Brown with American Sleep Dentistry. I, along with other dentists at American Sleep Dentistry, have fit thousands of patients with sleep appliances, helping them attain a better night's sleep without the use of a CPAP. Taking an impression on your upper and lower teeth is extremely easy and is done in the comfort of your home. Let's review how to take an impression of your upper and lower teeth.
American Sleep Dentistry mails you an impression kit with everything needed to take an impression of your upper and lower teeth. When you receive your impression kit, one of American Sleep Dentistry's assistants will help you install the American Sleep Dentistry's Telehealth app and connect you with one of American Sleep Dentistry's sleep dentists. This allows you to see the dentist and the dentist see you. Once connected with American Sleep Dentistry's dentist, open the provided impression kit. Unwrap the plastic from the impression kit and lift up the front tab on the impression kit. Inside the impression kit, you will notice 4 blue impression trays, 1 bite registry tray, and 5 blue and 5 white impression material tubs. Start by taking a blue impression tub and a white impression tub. Remove the blue and white impression material from the tubs. With the tips of your fingers, knead them together as quickly as possible. Quickly mix the putties together until the putty is a consistent blue color. There will be no veins of white in the impression material once mixed thoroughly. Roll the mixed putty into a hot dog shape. Place the hot dog shape in the blue tray and smash it down with your fingers until it is flush with the upper edge of the tray. Next, grab the upper tab with your index finger and place your thumbs on the back portion of the tray. Open your mouth and slide the tray back until your front teeth are between the front 2 walls. Then, press straight up with your thumbs. Continue to press until you can press no more. Do not rock the tray back and forth or side to side as you press up. Do not talk. This will distort the impression. This same procedure will be repeated on the lower teeth following the exact same steps. The difference is, grab the tab of the blue impression tray with your thumbs. Place the tray in your mouth and press straight down with your index fingers, pressing on the back portion of the blue tray. Continue to press until you can press no more. Do not rock the tray back and forth or side to side as you press down. Next, we will take a bite registry. To take a bite registry, remove the white and blue impression material and mix them like before until the impression material is a consistent blue. Separate the mixture into 2 halves and place half on top and half on the bottom of the white bite registry. Press the impression material so it is flush with the edge of the rim of the bite registry. Remove and throw away any excess putty. Place the bite registry in your mouth so that your teeth are behind the front wall. Bite straight down. Do not bite straight down with your front teeth first as you would an apple. Instead, bite down as if you were biting with your back teeth. These impressions will then be mailed to our dental lab where your custom-fitted sleep appliance will be digitally fabricated and mailed back to you to be fitted by one of American Sleep Dentistry's sleep dentists in the comfort of your home. Have comfort knowing that a sleep dentist will be with you at each step in taking your impressions. Taking an impression is just that easy.
American Sleep Dentistry is committed to providing you with the best sleep appliance and best experience, resulting in a good night's sleep. To begin this simple process, fill out your name and phone number and click Submit. One of our assistants will arrange a free telehealth appointment with one of America's Sleep Dentistry sleep dentists to verify if you are a candidate for a sleep appliance. Once again, thank you.